Today we are going to be doing 2 projections to locate any kidney stones. The 2 projections we will be doing is the KUB Scout and the LPO projection. These projections can also be done for the intravenous urogram procedure. For these projections, you will need to make sure that the patient is notified that there is going to be iodine-based contrast will be inserted in a vein in their arm and travel through the bloodstream and collect in the kidneys. This contrast will show up on any radiographs taken throughout the intravenous urography procedure. Since this is an invasive procedure, we need to make sure the patient has a conformed consent, and we need to ask questions like a chance of any pregnancy, any allergies specifically based to iodine. Does the patient have any asthma, hay fever, or hives? Does the patient take any medications? Has the patient had any allergies to contrast media in the past? And does the patient have any complaints like hematuria or flank pain? Before we get the patient dressed, depending on the department protocol, we need to make sure their creatinine is between 0.6 and 1.5. Make sure and ask if they're taking any medications like metformin, and need to make sure that the patient has used the restroom to get rid of any fecal matter or waste, so that way the x-ray will show up clear for the radiograph. Once we have all that, we'll ask the patient to remove everything but their shoes and socks and put on a gown. For our first projection, we will be doing a Scout KUB. I will have the patient put their arms down by their sides. Then I'll put a right marker in the bottom right-hand corner of the cassette. We'll be using a 14x17 cassette with a 40-inch SID. And then I'm going to line the patient up to the level of their iliac crest and mid-sagittal plane. Make sure there's no rotation. Okay. Then I'll put a shield over the patient's breast for psychological reasons. Then I'm going to measure Then I'm going to go out and set my exposure factors. Then I would set my exposure factors based on this exposure chart, and I would use a large focal spot and a Bucky receptor. And then I will make sure before I expose that the patient takes a deep breath in, blow it out, and hold it out. Now for our second projection, the LPO projection. For this projection, we'll be looking at the elevated kidney and the downside ureter. And the projection requires a 30-degree obliquity, so I'll have the patient roll up onto their left side. Place that under there, keep that there. I'll actually have the patient put their right arm, and you can relax your legs if need be. I'm still going to have a 40-inch SID and a 14x17 lengthwise cassette, but I'm going to put a left marker. And I'm still going to line the patient up to the iliac crest. And make sure that the central ray is lined up with their spine. Crest, spine. Okay. Then I'll take another measurement. Then I would go ahead again and use the exposure chart to set the appropriate exposures and still use a large focal spot and using the Bucky. And then the same breathing instructions, take a deep breath in, blow it out and hold it out, and then expose.